0508. This is the week of July 8th, 2019. Summer mind and body connecting to the lifespan. You guys are just knocking it out of the park. You guys are doing really well. Julie and I are super happy with your performance up to this point in time. Your discussion interactions are spot on. We've been posting the grades, so go in and check your grades. We've graded all the papers that we have received up to this point in time. And yeah, the papers were phenomenal. You guys are ready to perform your own studies in your own facilities. It's really, really neat what you've done. I really love some of the innovation and how you really threw yourself into it. Okay, so we're gonna this week we're gonna have our last biology part, very important biology part, and then we're gonna move on to interventions. Okay, and the first intervention is gonna be sociality. All right, so we go in here, we click right there. All right, awesome. Okay, and what I'm going to do here is turn off my phone. Okay, and what we do, sorry, we're going to, I am human, and I have text messages and stuff like that. So anyways, we'll go right in here and we'll talk about psychoneuroimmunology. Now before that, I just do want you to see, as we clicked in here, that we just put this in here to remind you. It tells you what to do. You go over here to the left and you click on the midterm exam, okay? So right here it says midterm exam. For those of you that the time on Wednesday the 10th from 7 to 9 is a perfect time for you, that's great. Some of you have approached Julia and said that doesn't work for me, and she will accommodate you, okay? You select the time and day and we make it work. All right, so you click right here when you're doing the exam. What I encourage you to do is open the exam twice. So here it is right here. I've already opened it a second time. And that way you can go in and out of the course and find information if you want to use that as a tool, okay? So you just come up here. When it's your turn, you won't see this. This is my instructor view, okay? And you click on this, right, and it'll take you right into the midterm. It says begin, okay? And it's just like the quizzes. You have 2 hours, 30 multiple choice. Every step of the way, anxiety is a psychological stress that turns on the sympathetic nervous system. Does it turn on the parasympathetic nervous system? This is fight or flight. Does it rest and digest? Does it turn on digest? Is it all the above? So the answer right there is there, and you hit boom, save answer. Okay, and you just do this all the way through. Back, go check back and forth. You have 2 hours, and then when you're done, you hit save and submit. Okay, so that's how that works. All right, that's your midterm. Alrighty, but I want to come back here and discuss what is a really, really important topic, okay, and that is psychoneuroimmunology, okay? So we're going to come back in here. I'm going to scroll down here to psychoneuroimmunology. Again, this is the last biological subject. Like I said, if I go back, I'm showing my ADHD here, and yes, we all have our issues. And I'm going to talk a little bit about my own experience with cortisol today, all right? You see that the next one is the mind-body connection and sociality, which is applying interventions and seeing what it does to all the biological principles that you guys now are masters of. Okay, so psychoneuroimmunology, okay? As I indicate here, this is an enormous field, a super important field. And interventions in clinical depression help in terms of findings are seeking it out and demonstrating things like helping with autoimmune disease. In immune depression, it helps with infectious diseases, how often you get the flu and how severe it is. And depression can even help, the findings are finding with respect to some forms of cancer, okay? Vice versa, all the inflammation of those diseases, if not kept under check, they can cause depression and stress. So it's kind of like, again, this kind of self-reinforcing, out of control cycle of events. It's a downward spiral, and this is all about figuring out ways to break the cycle and to improve everybody's health. So I do basically what is a really good overview of the one side of things right here, the nervous system modulation of your immune function. And then I go over here and I talk about immune system modulation of nervous system function, okay? We have a couple of papers in here. This is from our friend Sapolsky. A couple of them are fairly complicated, and that's okay. I just want you to kick back. I want you to know what you do know. Watch this video first before you get into it, and pull from it what you think is really, really, really interesting and where the trends are headed. From there, then you watch 2 videos. This is an amazing video about the Center for Psychoneuroimmunology. This is the interaction of the brain and the immune system at UCLA. And then this incredible talk by Professor Kavita Videra, and she really lays out the interaction between the brain and immune function, clinical depression and immune function, controlling depression and controlling immune function. She has 2 things that she looks at. She looks at the immune system response in terms of vaccinations and the ability to fight off infections like the flu, okay? And then she also looks at a kind of unfortunate complication of diabetes where the immune system is compromised and foot ulcers appear. And so she was looking at the brain and its ability to modify the severity of foot ulcers in diabetics. Again, this mind to body connection. Okay, awesome. Alrighty, so we can get over here. We'll start with this paper. And I'm warning you, okay, that paper is fairly complicated, but it's okay because I want you to be able to go in there and really get excited about this paper. All right. Now, what I talk about here in a little bit in my preamble, right over here, and I'm going to go back over there. I say yes, this is a complex medical journal article. All right. So don't get lost in the details. Watch for my video. So the first 2/3 of the article explains how the brain, the mind interacts with the immune system and back and forth, vice versa. And the last third of the article for me is really exciting because it's about lots of new drug treatments and new strategies. And these are not only allopathic medicine, which is a kind of medicine practiced by medical doctors here in the United States, but also alternative forms of therapy, herbs and lifestyle changes, and how that can disconnect these pathological interactions between the nervous system and the immune system. All right. It is real important that it talks about stress, since that's been our central theme. It talks about clinical depression, and it talks about this pathological interaction between the brain during stress and depression, and what it does to immune function. All right. Awesome. Okay, very cool. All right, so I'm going to get back down here. I'm going to look at my article. All right, and we're just going to sift through it real quickly here. Okay, so again, this is a pretty significant article by some serious leaders in this area. Okay, and but it goes over some things that we've talked about. Okay, so what it's going to do is going to connect inflammation. Okay. And it's going to look at what's happening in depressed patients, okay? People that have high levels of stress, okay? And what they're looking at, their readout in terms of inflammation, they're looking at things called inflammatory cytokines, okay? And as you saw up here, I talk about it. So a cytokine is just a cellular messenger, okay? Lots of cells release cytokines, okay? And then the immune system releases its own set of cytokines called lymphokines. Again, these are just messengers that activate all kinds of immune system cells to help fight off infection and to do tissue damage repair when you have an injury and things like that. So the point of the immune system is not inflammation that will tear you down. The point of the immune system is inflammation that protects you against infection and helps you to rebuild your body. It's just that it has to be in perfect synchrony and balance. And when it gets out of synchrony because of a brain problem, because of chronic infections, things like that, because you have an autoimmune disease, that's where the problems begin. Okay. So again, just read through this, okay? They talk about how the immune system and depression can affect what is called monoamine metabolism. That's really important because these monoamines in the brain are what give us a lift. Dopamine gives me my reward. Adrenaline is what drives me oftentimes. And serotonin is the one that makes me feel connected with the universe, so to speak. It's definitely connected with my friends, my classmates, with society. And so serotonin is the primary target of selective serotonin reuptake inhibitors, things like Lexapro, like Prozac, all these different types of drugs that are out there that increase the levels of serotonin in the brain by blocking its removal. So that's what this is. I'm just giving you kind of a quick overview of some of the vocabulary. Okay. All right. So their premise is understanding the mechanisms which cytokines alter behavior have revealed a lot of what I think is exciting pharmacological targets that can be unique and alter the impact that inflammation has on your behavior. Okay, on how you respond to a stressor and whether or not you become depressed. Maybe it will even work in terms of the prevention of depression in patients. Okay, so that's their basic premise. Okay, so then they go into some of the signaling pathways, and you're going to hear this when we look at the video from the Cousins Center. They're really, really involved in what are these pathways, because then you can target them. So this one right here, cyclooxygenase. It's something like you're like, well, what's cyclooxygenase? Okay, it's something that unknowingly many of you tap into all the time. Okay, so I have a lot of sports injuries. Okay, and so I take Celebrex. Some of you take Advil. Some of you take ibuprofen. Okay, even aspirin helps to block the action of cyclooxygenase, and by doing that, this is an enzyme that creates a number of other molecules that increase swelling and inflammation. So it reduces the swelling and inflammation, and that's why we take it. Swelling and inflammation can cause a headache. Okay, that's why you take it. Alrighty. Here's another protein that's very important. Okay, you're going to hear a lot about this. NF kappa B, nuclear factor kappa B. Okay, it is turned on inside your cell's nucleus, and then that nucleus will churn out so many recipes for so many inflammatory proteins. So if we can block the guy that's going in there making copies of all the recipes, then you're not going to have the inflammation. Okay. There's another enzyme that's exciting in this particular article right here that causes a breakdown of the simple amino acid, okay, that is used to make serotonin and make us feel good in our brains, into this toxin in our brains that causes nothing but problems. Okay, and this particular enzyme is increased during inflammation. Okay, awesome. Then they get in here and they talk about some other aspects of outside the biology. So I said psychological stress. We've gone over this over and over again. Your diet is important. Okay, whether or not you have obesity. Okay, problems in your gut, like a lot of people have with inflammatory bowel disease. Okay, they are linked to the development of depression and its reoccurrence. Okay, so these are really important concepts. Right. So again, you just take the abstract and you just pull it apart, and lo and behold, you guys got this down pat. Okay, the idea is that once we figured out all these molecular pathways, okay, how cytokines influence our psychological behavior and how we respond to stress, that we are going to develop some really personalized treatment options that can target this unique interaction between the immune system and clinical depression. Okay, so that's what this is all about. All right, so you just go through this now, and I understand it's thick, and you read as much as you can. Okay. This goes over the link, making the case between inflammation and clinical depression. And they go through a lot of inflammatory proteins. Now, one thing I do want to talk about, you're going to see in this paper and the other paper, they're going to talk about a compound called Tnf Alpha, and that is a target in it gets highly elevated in inflammation, especially in autoimmune diseases. You'll see that it also can cause an elevation of C-reactive protein. There's something that is looked at when you do a simple blood test looking for inflammation. I'll just give you an aside. A normal CRP level is 3 or less. And when Julia got diagnosed with her Sjogren's disease, an autoimmune disease, and Hashimoto's disease, an autoimmune disease, her CRP levels were almost 8. Okay, and so it was like a wake-up call. These are the cytokines of interest. Interleukin-6. There is a drug out there that can block the action of interleukin-6, and tumor necrosis factor alpha. Again, there are a bunch of drugs that target this TNF alpha. Different ways of going after it. One of them is Humira. Another one is Embro. Okay, and the other one it starts with an R, and I can't remember the name of it. But the bottom line is it helps reduce inflammatory bowel disease, rheumatoid arthritis, psoriasis. It's used for a number of autoimmune disorders. Okay, so it's very, very exciting stuff. Okay, and we look at how the brain and depression and stress can influence these markers and vice versa. Okay, if you have an autoimmune disease, you may feel depression. One is because it's because of the way you're thinking, and the other is because the actual biology of the interaction. Okay, all right, so how do they know this? Well, you can administer these drugs directly into people, and people become depressed, or you could use animal models. Okay, so that's separate from the psychology of, oh, I've got this disease, because it's a direct effect. So that's a pretty clean experiment right there. There's a number of studies that show that stress modulates inflammation. Okay, it's a difficult concept. Okay, because short-term acute stress can actually reduce inflammation. Okay, but the chronic effects, because the system desensitizes to it, can actually cause lots and lots of inflammation. Okay, so there's lots of studies are looking at how it all plays out sequentially, but the bottom line is chronic stress causes inflammation. Okay, initially because of the anti-inflammatories, something like cortisol can be initially an anti-inflammatory. What happens then is that you can be overtaken by a virus or a bacteria because of the initial immune suppression. Okay. All right, and then that causes a lot more inflammation because you're being taken over by the bacteria. All right, later on, because you kind of become desensitized to the actions of cortisol that we looked at in previous sections of this course, then your chronic levels of inflammation start to skyrocket. So it's a very complicated thing. There's a lot of controversy, but just know there is definitely an interaction between stress and inflammation. Okay. Talking about cortisol and inflammation. So you know what I did today? I went and I had a steroid injection right here in my cervical vertebral column, right up against my spinal cord, and I had 2 done in my lumbar. Why is that? Okay. So I'm having some pretty significant problems because of being an athlete my whole life. I had this one thing called surfer's neck. For 50 years, I've had my neck extended, and I've been paddling like a madman. And what's happened is I've got really bad arthritis and bone spurs. It's called spondylosis of the vertebral column that's now pushing on all the nerves, and it's really painful all through my arms, and it's a bummer. It sucks. Okay, so I've tried all the physical therapy, and now I did the steroid injections. There's a chance I'm going to have surgical removal of bone in my neck. I had the same problem down in my lower back because I was a kid and I was surfing and I had a massive herniation in my lower back. You know what the theme of that story is? Okay, is that you play hard, you pay hard. Okay, all right. So here's cytokines. They get into the brain. There's this thing called a blood-brain barrier, but it's not perfect. Okay, especially when you have high elevations of activated immune system cells releasing these cytokines. So here's this TNF alpha that Humira goes after, that Embro goes after. Okay, and it is released by our immune system cells. These are different types. These are monocytes right here that become macrophages. They come in here and they activate the brain's own immune system. These are called microglia, found in the brain, and they become too aggressive. And they mess with our immune system. They actually cause cell loss. Okay, inflammation causes lots of cell loss all throughout the brain, lots of diseases. Inflammation causes cell loss in Alzheimer's. It causes cell loss in Parkinson's. It causes cell loss in amyotrophic lateral sclerosis. It causes cell loss in multiple sclerosis, and there's evidence it causes cell loss in clinical depression. All right? Okay. They show right here, again, this is the brain, okay? Another blood vessel, okay? So we have all these immune system cells, okay? And they will bind to surface receptors, okay? And release their cytokines that will come on here and, again, activate the nervous system. They talk about different types of immune system cells. Some cause brain growth, some cause brain atrophy, okay? So there's this concept of resilience, okay? And I'm going to send you a link to the group here at USC that studies resiliency, okay? Which is really, really cool because it's about behavioral modifications and how some people that learn how to deal with stress, okay, through yoga, through exercise, through meditation, through socialization, that their immune brain, their immune mind interaction is far superior, and they develop a resiliency instead of a pathology. All right, so it's really kind of cool. I'm going to send you guys that link as well. All righty. Okay, so again, fairly thick. Just kind of make your way through it. This is again the concept that cytokines will activate this peripheral immune system cell. That's what a macrophage is, and it then causes this conversion of the very compound that we use to make serotonin into this toxin, and it causes degeneration. It causes cognitive dysfunction. It causes these problems in terms of how our brain does its normal functioning. Okay? All righty. This goes right here, and it talks about the interaction of inflammatory messengers. Fairly complicated right here, this figure. Okay? But what the bottom line is, inflammatory effects have on our neurotransmitter systems. Okay? Sorry, this one right here. Right? So these are all neurotransmitters, okay? This one here is serotonin. This one here is making of dopamine. This one here is a precursor to making tyrosine to make dopamine, all right? And we see all how the inflammation affects them. And that's what that's all about. All right, so you just keep coursing through this, guys. Here's all the contributors to chronic inflammation: obesity, diet, life stresses, psychological stresses, problems with your gut, okay? It directly communicates with the brain from this nerve that goes from your stomach up to your brain. It's called the vagus nerve, and you're going to hear all about that. And impairment in our T cells, okay? When you have chronic inflammation, you get cardiovascular disease. We know about that. It's a risk for diabetes, whole different class. It increases the risk for cancer, and per what we're doing right now in terms of the mind-body connection, it increases clinical depression. Okay. All right. So when we get down here, then you kind of course through this, okay? And this is kind of the exciting new stuff, okay? This is the translational implications. So we're going to develop some new treatment targets that are unique to the immunological contribution to our brain problems, okay? And so they kind of go through lots of different things, okay, right here. Just read as much as you can, cruise through this. Don't get too caught up. Okay, there's another one, okay, the inflammatory reflex, all right? And this talks about one specific one, that interaction of your nerve that comes down your tummy, okay? It's called the vagus nerve, and this release of acetylcholine, okay? And this is during the rest and digest response, okay? So it talks about anti-inflammatory responses and how they can inhibit inflammation, all right? We have two different ways of looking at this, all right? So we have fight or flight response, okay? Adrenaline rush, boom, okay? In the short term, that adrenaline rush can actually inhibit our immune system, okay? That's fine, all righty. And we also see a selective kind of a beneficial inhibition of the immune system with the rest and digest. The problem with the chronic fight or flight response is that it causes the brain sensitivity, to the stress hormones, gets reduced, and so suddenly the stress imbalance happens, and then you get more and more inflammation. So again, I think the most important thing you should understand from this is that there is an imbalance, okay, that leads to between the stress response and the inflammatory response. So it goes through, the connections in this article, okay. Again, we have this vagus nerve, okay, that connects to our heart, our liver, and our gut, okay. It releases this compound called acetylcholine. You see that right there. And the acetylcholine interacts with this immune system cell. This guy releases the cytokines, okay? So that's what that's all about. It comes down here. Here's our immune system cells, neutrophils, monocytes, macrophages. These are all our first line of defense immune system cells, okay? And then we have things that are released, okay? We've heard about the cortisol and the glucocorticoids. We also release this compound from the in the pituitary called MSH, okay? And they have this kind of negative effect right here on the macrophages in the acute sense, okay? We have the brain fibers that come in here, okay? So the adrenaline can initially inhibit, and then it can in the side. You see that the cholinergic neurons will reduce TNF, super good for autoimmune disease, okay? Pain fibers seem to increase TNF, okay, like me, okay? All right, so just go through this, interpret it as best you can, and then this again goes over the vagus nerve, releasing acetylcholine to modulate your immune system cell, okay? This talks about different types of fibers that will pick up the cytokines, okay, and cause more pain, okay? And then that causes more stress, okay? So it's like this, and it causes more of this right here, which is the other stress response. All right, here's your vagus nerve right here that talks about it. So again, go through this as quickly as you can. Don't get caught up in it. All right, then in comes our good friend Robert Sapolsky, and he talks about primate inflammation as it relates to where you are socially. It's important because we're going to talk about sociality later on this week. So it's just a kind of a fun read. He really caps it well. You see, it's only 2 pages. So we can look at where you are in the social status and what that does to your inflammation. And guess what? It gets really, really out of hand. All right. So we get in here to this is the Cousin Center, and they talk about this connection between our brains.
The Cousin Center is very interested in understanding the interactions between the brain, the body, and the immune system.
And it's really awesome.
And the
we
science
can see this here.
Life to change the way disease unfolds in our body. Part of the reason it's important to do this kind of work is it helps us understand what's going on in the black box of epidemiology, given our evolutionary heritage.
We study those primarily in the context of cancer. So most of our work is trying to understand things like what are the pathways through which stress can get inside the body and potentially impact things like tumor development and progression.
Which is scary.
Also, we're very interested in trying to understand how changes in the immune system can influence the brain and behavior, leading to symptoms like fatigue, cognitive problems that plague cancer patients and so
whether the inflammation is causally increasing depressive symptoms.
We've been very interested in how stress impacts health outcomes, and one of the most striking...
Super good video, okay? All right, then you come in here and you watch, if you please try and do it. It's a half hour long, but this is an amazing study that Dr. Kavita Vidar explains at this conference, where she looks at stress, clinical depression, and outcomes in terms of mounting an immune response, in terms of how well you can respond to vaccinations for the flu, okay, and looking at it in older people as well, okay. And then she looks at diabetic ulcers, and again, the interaction between the brain and diabetic ulcers. Okay, super cool. Take your time on this. This is important stuff, okay. I'm going to go back. We're going to see that then, talking about the Sapolsky article in sociology, then we're going to get in here and we're going to start looking at this this connection, this later on this week, the mind-body connection in sociology. Okay? Alrighty. So we want you to then jump in here, and we want you to go ahead and post them on Blackboard as best you can remember. Okay, that tells, I do that every time. Sorry, we're going to the not how to post on Blackboard, but to go in the actual Blackboard assignment, and it's down here. Okay, and we're getting down to number 7, lucky number 7, Psychoneuroimmunology. So I kind of lay this out here, and you just do the best you can, and then just kind of envision, as the cousin video shows, how stress reduction affects inflammation, as a result, immune function in positive ways. Okay, alrighty, and this will be real great when you guys apply this to your own work setting. Okay, guys, so that is it. Okay, and do realize that Julia is going to be sending out an announcement shortly, because there is going to be a downtime for Blackboard this coming weekend, and we're going to make sure that everybody is accommodated for this as well. So we'll give you more information about that in a few. Until then, we'll see you next time.